Federal Drive is presented by GEHA, Government Employees Health Association, proudly providing health and dental benefits to federal employees and their families. Visit GEHA.com.
Health and Human Services recently updated regulations for an activity on which it spends billions each year, scientific research. The regulations deal with research integrity, and they've undergone their first overhaul in 20 years. We get details now from the director of the HHS Office of Research Integrity. Joining me in studio, Sheila Garrity. Ms. Garrity, good to have you with us.
Good morning, Tom. Good to be here.
And let's start with just a brief overview of the Office of Research Integrity. What agencies does it cover, and what does it generally do in the first place?
The Office of Research Integrity is part of HHS, Tom, and we're part of OASH, the Office of Assistant Secretary of Health. So our responsibilities include oversight of research funded by the Public Health Service. And so if there are questions involving that research integrity issues, we review those questions. We also provide funding and training in the responsible conduct of research. The agencies in the PHS include NIH, CDC, National Cancer Institute. Typically anything you can think of is within.
So the big money grant agencies.
Yes.
Not just headquarters.
Right.
And these regulations, what are the issues in research integrity that they cover in the first place?
So research integrity, what people think of when they hear research integrity is research misconduct. You probably see journals such as Retraction Watch that cover cases of research misconduct. And when those allegations involve federal funds, PHS funds, the institution has to look into those, and then when the investigation is done, we do regulatory oversight. So people hear the bad things, but PHS funding also does a lot of good things. Life-saving treatments happen because of public health service funding.
And these rules on research integrity, what are some of the areas where integrity could be lacking?
Integrity could be lacking in how research is performed. So the definition of research misconduct is fabrication, falsification, or plagiarism in the proposing, performing, reporting, or reviewing of research or research results. So in a research grant, there could be research misconduct. In figures in a publication, there could be some fabrication or falsification. All of that falls into those buckets of research misconduct and integrity.
And what about, say, failures of omission? Like, for example, you hear sometimes, well, this or that industry was behind this piece of research, and that may not have biased it, but it should have been disclosed.
So those issues are not within, those are research integrity issues, but they don't fall under our regulation. There are, your listeners will be aware of scientific integrity policy, which applies to government employees. And there's a lot of disclosure issues covered there. We are all required as government employees to once a year disclose all of our outside interests. And if you are publishing your research, remember federal employees do a lot of federally funded research themselves, you need to say, okay, I was funded by this grant, or I helped here, I was on this board. All of that just needs to be disclosed.
Okay, so getting back to misconduct, the rules then cover those things you mentioned: fabrication, falsification, plagiarism. What was it that was out of date, say, versus 2005?
2005, which is when I came into this field, when that regulation came out, we've gained a lot of experience, and research has changed since 2005. Look around you at how your studio's changed. You told me you've been in this business for 40 years. I'm sure it didn't used to look like this. It was entirely different. Research, the technologies to conduct research has changed. Research also has no borders. The collaborative research that's done between institutions in different states and different countries, that was not addressed in the former policies. So we went to work to craft a policy that would be timeless, that would last for the next 20 years, and with enough flexibilities to allow us to grow as research grows.
We are speaking with Sheila Garrity. She's director of the Office of Research Integrity at Health and Human Services. And that technology idea, I imagine one of the things on the drafters' minds of these regulations had to have been artificial intelligence, which has potential to really enhance research and also to really bungle it pretty badly.
Artificial intelligence is on everyone's minds, and we can't run away from it. We can't ignore it. It's here. And as you said, it can have a lot of good uses, but it has a lot of bad uses. Artificial intelligence is not mentioned in the regulation, but it's suffice to say how research methods have changed so that we have made room to grow as we get a better handle on AI.
Now, reading some of the changes that you've highlighted, they look kind of administrative and picky, clarifying institutional confidentiality obligations, providing clearer descriptions of research misconduct investigation requirements. That sounds a little meta in terms of the research itself. So maybe tell us.
Right. Picky leads to a lot of lawsuits, Tom. So we had to be careful. And I came from the academic world. So I was a research integrity officer for almost 30 years at two different institutions, one being Johns Hopkins, which is the #1 recipient of federal funds in this country, and then I was at George Washington for 9 years. So institutions have to follow a very prescribed process in how they address these allegations, and that is for their protection and for the protection of people accused of research misconduct and the people that bring the accusations forward. So in order to protect the process, we made some clarifications, changed definitions to help the institutions and to help us. There's a fine balance between overstepping, either on the institutional side or our side. Confidentiality is a concern. Say you're accused of misconduct. We don't want to automatically assume that you committed misconduct until a process has gone through. So institutions keep those matters confidential, and you see lots of that in the press. We can't comment on ongoing matters, so we made sure to address that.
And these rules, were they considered major in terms of federal rulemaking requirements? If it has a certain cost level, it becomes what they call a big rule or a major rule, and therefore had to go through the White House, the OIRA. Was that the case for these rules?
It did go through OIRA, not because of the cost, but because when the NPRM was issued, and the ORI leadership said to OMB, these changes are not going to receive a lot of comments. People are going to love them, so don't worry. So it was allowed to waive review from OMB. Well, then when the NPRM came back with nearly 300 comments, many of them quite opposed to what was in the NPRM, OIRA said, hey, now we got to look at this. You got a lot of comments. So they did.
We should clarify for the audience, Office of Information and Regulatory Affairs. Even a lot of feds don't know about that little office in OMB.
Created by Ronald Reagan.
Indeed, yes, because, rulemaking, that's always a subject of political discussion, let's say. And the comments, do they mostly come from academic recipients of research grants?
They did mostly come from academic recipients of research grants. Some respondents' attorneys also weighed in, and they were concerned that the rule was overly prescriptive in terms of the process, that you had this many days to complete an assessment. And
they saw what I saw in it.
Yes. And so they wanted a little more discretion, and we gave them that. And for the federal employees listening, I'm a new Fed. I've only been here a year and a half. The number of people that it takes, the number of different offices to get a regulation across the finish line is incredible. And, I think the outside world thinks the feds are always bashing each other. People were incredibly helpful. Here's what we need, Sheila. Here's how we need to get it through OIRA. Do this, do that. And I am really grateful for all the teamwork that I had.
And I imagine some of the institutions that do the research under grant